Hi, I'm Dr. Jack West, and I'm a medical oncologist, an associate clinical professor with a focus on thoracic oncology, working at the City of Hope Comprehensive Cancer Center in the Los Angeles area. And I'm happy to be joined today by two of my colleagues who are also on the board of directors for GRACE, Global Resource for Advancing Cancer Education. I serve as the founder and president, but I'd like to welcome two of my colleagues to introduce themselves, if you can. Maybe I can start with you, Jared, if you can.
Sure, I'm Jared Weiss. I'm also a thoracic oncologist at University of North Carolina.
Ben?
Yeah, Ben Levy. I'm a thoracic medical oncologist at Johns Hopkins School of Medicine and primarily based out of Washington, D.C.
Great. So let's turn to the other is maybe the evil twin of vaccines are rolling out. The numbers are going down in a favorable, and that is we are now experiencing a lot of variability and extremely mixed messages about how to open up, whether it's safe to open, all sorts of things, and including a lot of quibbling amongst ourselves and respected, thoughtful people about whether we should change our behavior once you've been vaccinated. Is it safe to go without a mask or, congregate with other people who are vaccinated? And, how vigilant do we need to be? Do you have personal recommendations or institutional or professional ones because I would say, especially in a world where we're getting news that, a state here and a county there is relaxing their policies and you can now dine indoors and all of this, I think we have a lot of uncertainty both about what to do and what's going to happen.
Yeah, I think, this is such a fluid situation. I think there are going to be more recommendations coming out soon about what patients post-vaccination should expect and how they should behave. I try to keep my recommendations very broad. We get a lot of questions about this now that a lot of our patients are vaccinated. The biggest question I get is, can I go see my grandkids or can I see my kids? And you got to ask about the situation and the scenario and whether and I think it is a judgment call. I think, I always tell patients, the safest thing is if your family is not vaccinated, even if you are, you're not at an absolute zero risk. I don't tell them, and this is where we may have some differences. I don't tell them not to travel. I just say, look, this is a risk assessment for you that you have to make a decision. And I can't tell you that you're not out of the woods, even if you are vaccinated. We have some data that's been generated now to suggest that it may be safe, but I use the risk assessment model when patients are asking me whether I should see my kids or not, or I've got all my friends are vaccinated and they want to come have a bridge game or whatever. I say it's a risk assessment. The odds are that there's very little likelihood that there will be any consequence out of this clinically or medically, but you're not 100%. And I continue to tell them to mask. I continue to tell them to social distance until a large majority of our population gets vaccinated. Hopefully that will happen in the next 3 to 6 months. But that's my approach. And I don't know if that's right or wrong, but I use the risk assessment approach. I don't say yay or nay. I say, this is low, medium risk.
I think it's appropriate for us to acknowledge when we don't know and we have to rely on judgment. And again, it is discomforting to everyone. We want some certainty. Patients want to be able to ask and get a clear answer, but we also have to be honest in saying we don't know. I think that another issue is there's the variable of time of how long the vaccine works. We don't know that as well. And a lot of the recommendations that I've seen as infographics on social media say, okay, well, within 3 months of your vaccine. Well, a lot of us got vaccinated pretty close to 3 months ago. So these are all pretty close to data-free zones right now with 1,000 different variables. I don't know what you're saying, Jared. I think at the end of the day, maybe the best answer is to acknowledge what we don't know and leave it up to judgment, but not be foolhardy, but also not be extremely rigid indefinitely when we don't know if that's justified.
My conversation is a lot like Ben's with patients, along the lines of what's worth it and what's not. So, if you're vaccinated, is it really that valuable to you to walk down the street maskless? Or when you congregate with other vaccinated people to not wear a mask? I'm going to make the argument, and maybe I'm overstepping bounds here, that wearing a mask isn't that big of a deal. And if it can save your or someone else's life, wear the bleeping mask, right? It's not a high cost. Now, when you talk about other things like, can I see my grandchildren? I haven't seen my grandchildren in a year, right? I've been perfect about this. I haven't left my home. That's a major quality of life issue. And as we advise caution, and I know all three of us throughout this have advised caution, we can't do what the opposition has done, which is to say be agents of distruth in favor of what we believe, right? Our data does argue, as Ben said, there's some hints that vaccines actually do help prevent spread, right? There's a lot on social media from people advocating caution in the way we are, saying that they don't. Actually, the data argues, if anything, that they do. And so I think it's what's worth it, right? So if you haven't seen your grandchildren in a year, and that's a major quality of life issue, go see your grandchildren. But when you go, is it really worth it to be indoors versus outdoors as it's warming up? Or could you pick a warm day and see them on your screened-in porch or outdoor in somebody's yard? I would argue go see them, but take the precaution of being outdoors. And if you're going to go see them, is it a big deal to ask your grandkids to wear a mask? I have a 2-year-old. She loves her donut mask. As her big sisters wear masks, she wants to wear a mask. Young children can wear a mask.
It's more behaved than I am. Mine is.
It's a very cute mask, but it's not a big deal wearing a mask. If it's just the expectation, this is what we do as a family, then children will wear a mask. Everyone can wear a mask. And now you're doing what you want to do, but you're doing it in the safest possible way. And that's the kind of message that I'm giving as, look, it's a values-based decision, but once you choose to do it, enact whatever precautions you can to make this smart.